I'm Jessie. I'm a student nurse in third year nursing at the University of Manitoba, and today I'll be showing you guys how to reconstitute and dilute a medication via mini bag. So first I'm just going to do hand hygiene here. I've already compared my doctor's orders to my MAR to make sure that everything's transcribed correctly, and now I already pulled my vial from Pyxis, and I'll just do my first med check with my vial here of methylprednisone. So the right person is Emma Wrightson. Just noting that she has an allergy to morphine. Right drug is methylprednisone. I have methylprednisone here in a 125 milligram vial, and my dose is 75 milligrams, so that will be okay. Noting the expiration date is okay, and it says I can give it IV, which is my right route, and it's every 6 hours, which is due at 1200. So now that I've done my first check, and just noting the integrity as well of the vial, now that I've done my first check, I'm just going to go to my drug parenteral monograph, and so I'm going to pull up that. So I have the right drug here of methylprednisone, sodium isocyanate. It's a steroid, and so she has, or my patient here, Emma, has rheumatoid arthritis, and she's coming in just for some treatment for that. So this will help her with her inflammation. It says that it can be administered by a student nurse, which is me, and it says the usual dose is between 40 to 250 milligrams IV every 6 hours, so our dose is within a safe range. And then I will just flip to the other side here to go to what I need to use to reconstitute and dilute and such things. So for, it says 125 milligram vial, I need to dilute it in 2 milliliters of sterile water. So I have my sterile water here, and then I'll just grab my alcohol swab, and I'll open up these 2 caps. And alcohol swabbing for 30 seconds and letting it dry for 15. But for the purpose of this video, I'll just quickly alcohol swab and then pretend that it's 30 seconds. So 30 seconds has passed for both. And as I let them dry here, 1 second, I will grab my 3 ml syringe here and grab a blunt fill as well. Just making sure to keep everything sterile as you open up the package. So we want to keep the end tip sterile here. And then grabbing your blunt fill, also keeping that sterile. And just putting that on decently tight. So now I'm going to pull back 2 ml of air, just a little bit sticky, so it's good to do that. So when you inject air into the sterile water to get that up into your syringe. And so now just pulling back 2 ml of sterile water.
So this vial didn't quite have 9.5, it only had about 8, so I'm just going to recap this to ensure sterility.
So I'm just going to take a little bit of excess compared to 2 ml, and then I'll just use scoop and swoop method. And I took the excess just because I want to make sure that I don't have any bubbles or anything like that. And then you just want to waste over the garbage if need be. So I have my 2 ml, no bubbles, and then I already alcohol swabbed this, so it's okay, and I haven't touched it. And this is my methylprednisone now injecting my 2 ml. And then what I will do is take back 2 ml of air to ensure that you get the right dose, and also for pressure, for sake of pressure. So just taking out that, and then again scoop and swoop method as best as possible. And now we're just going to take our vial and just slowly mix it like this. This just ensures that there's no clumps, you don't want to shake it, and stuff like that. So the drug monograph says that the final concentration for this 125 milligram vial is 62.5 milligrams per ml. So I did my my calculation to get the right dose, or how much I'm going to be drawing up, which was 75 divided by 62.5 milligrams, dose desired over dose on hand, which gave me a volume of 1.2 ml. So that's what I'm going to be drawing up from my methylprednisone here. So again, you just want to inject that amount of air. So I'm going to go to 1.2. And then I will just re-alcohol swab as best practice on my methylprednisone. And again for 30 seconds, and then just let it dry for 15 as well. And again, I have my 1.2 ml of air because that's the dose that I want to pull up. So that's ready to go. So injecting 1.2 ml of air. And just want to make sure you're not drawing up air, but you're actually drawing up medication. And you just have to get the bubbles out as well. Might have to do some fiddling with it.
Should have done scoop and soup for that. Okay. Now I have 6.5.
I just want to make sure we don't have any bubbles so we get the correct dose.
Okay. So I have
Okay.
medication here.
And just wanting to maintain sterility as well when you are around the vial and the syringe and the plunger as well. So I have my 1.2 here. So I'm going to pull back, and then scoop and swoop.
And this is for our patient.
And now if Emerald just wants to zoom in to the 1.2 ml, can you see it? Kind of. Okay. So here's my 1.2 ml. So now you want to grab your vial, you want your MAR, and you want your syringe of medication to do your second med check. So right person is Emma Wrightson. Right, and again, noting the allergy to morphine, that shouldn't be a problem. Right dose is methylprednisone. And we know methylprednisone is in here. Methylprednisone, right dose is 75 milligrams. And again, we had a 125 milligram vial. After doing calculations, I knew that I had to draw up 1.2 ml for a dose. Right route is IV. We know that we can give it IV, and that they have IV running right now. And time and frequency, is every 6 hours, which is at 1200, which is right away. And yeah, and so now, kind of done with that, looking at our drug monograph again, for IV intermittent, it says for doses less than 250 milligrams, after you reconstitute it, so in this state, you want to dilute further in 50 to 100 ml of normal saline or D5W and administer over 15 to 30 minutes. So I chose 100 ml mini bag. It's up to you what you decide you want to do. And I chose normal saline because I know that it's compatible with her line running right now, which is D5W 0.9% normal saline. And I chose 100 ml because it's the first time she's getting this drug. And I'm going to choose to go over 30 minutes or half of an hour. Just for sake again of the fact that this is her first time getting it. So now before dilution of this med, and again I've done my second check, you want to grab an alcohol swab and swab that port off here and just swab it before you inject the medication, just so again maintaining sterility. And I've pre-written again for 30 seconds for the purpose of this video. 30 seconds is over.
How many milliliters?
I just want to keep that end sterile that you've already swabbed, which is difficult. But just being careful. On the side, and just make sure that you maintain the integrity of the bag when you insert that blunt fill. And then scoop and swoop, and this will be going into sharps anyways. So now you just want to take your mini bag and just gently turn it over and mix the medication, again not shaking or anything like that. Yeah, so now I have my label here of methylprednisone with the right person. Again, you can do another check if you'd like. So right person is emmorrhizin. Methylprednisone is the right drug. 75 milligrams is the dose. And now because I've diluted 100 ml with the 1.2 ml, I now have a full volume of 101.2 ml. And I'll tell you guys what the pump rate is in a little bit. And then just noting date and time, which is 1200, and rate road is IP. So now I will just put my label on my mini bag. You just don't want to cover important information over the thing as well. Actually, I'll just take off this whole thing. Okay, so now what I'm going to bring with me to my bedside is my MAR, my medication in my mini bag, some alcohol swabs for my ports, my label for my tubing I can bring, and then also you just want to bring a piece of paper or something that tells you what your pump rate is going to be, which is 202 mils approximately per hour. So now I'm entering the patient's room. I have everything here, oh sorry, and my secondary tubing here. So I'm just performing hand hygiene. Hi there, Emma. I'm Jessie, I'm a student nurse. I'm just going to be giving you your medication via mini bag today. It's your methylprednisone. I'm just going to check your armband here against my MAR to make sure you're the right person. So, right person is Emma Wrightson. Can you state your name for me? Thank you. And your birth date? Thank you. And just noting again that she has an allergy to morphine. So, Emma, you're getting methylprednisone today. It's for your rheumatoid arthritis, and it will help with the inflammation with that. You might experience a headache, some restlessness, or potentially some depression. Those are common side effects, so just let me know if you're experiencing any of those or any other symptoms as well. And so now we just want to make sure that our primary is running at the correct rate, which it is. Just noting for bubbles, the chamber, the clamps are open, and also her IV site, that it's not inflamed or anything like that. So now I'm going to grab my secondary tubing. And I'm just going to hang my bag, my primary bag, lower than my secondary. So I have to do that.
And I'm just going to make sure it's going.
And it'll just keep going here. So now what you want to do is you want to take your spike off, and then spike your mini bag. And just because they're pre-spiked, you have to just be careful and keep them upside down for now.
The reason being is because I want you to also come back after it's done. So I am going to alcohol swab these.
Also, what you want to do is just make sure that your roller clamp is closed as well. And now what you want to do as well is just make sure that you do your third check at the bedside. So and you're going based off your label here. So you have Emma Wrightson, which is the right person. You have methylprednisone, which is the right drug compared to the MAR. You have right dose of 75 milligrams. And right road is IV, which we've noted. And right time and frequency is every 6 hours, which is at 1200. So we're okay. So now that we have our bag here, spiked, I'm just going to put it up here and just leave this, it's already kept sterile, so it's okay. And you want to pick the port closest to the pump here and just alcohol swab for 30 seconds.
Okay, that means it's flowing. And make sure there is no...
So I alcohol swabbed for 30 seconds, and now just keeping this port sterile, you want to take this cap off, which is being difficult.
And I am also going to document the procedure as well, and how the patient tolerated the procedure. And
now you want to back prime into your thing. So you're just going to lower this here.
So, and also I am going to like
Up until about
after
the
this
chamber is
is
half
infused,
full,
I am going to
or
do
to a
the
third.
pre-filled, 3-minute pre-filled
So-
penicillin, just so we can get all the
Just want to
medication
make sure that that's good.
to the patient. And I will do my exit safety check and document.
Rehanging that. And now you just want to click secondary. Rate is going to be 202. Volume to be infused is 101. And that was approximately 101. So now you want to click confirm secondary. And then press start to begin, and you just want to make sure that your roller clamp is open. It's programming secondary. And then you just want to watch for the first 3 drips as well. So it says that it's running, it's okay. And so now I'm just going to do the right documentation, which I don't have the proper pen for that, but I would have documented here. And then just coming back, I would have just noted that the patient is okay, that they haven't had any adverse reactions or allergic reactions or anything like that. And yeah, and I've done the right documentation, exit safety check. Yeah.